Greetings from India. I'm Dr. Urmila from Amrita Hospitals, Faridabad, National Capital Region of India. When Dr. Ahmed wanted me to say something about certain suggestions and tips of being a successful nephrologist, I thought, am I the right person to be doing this? But then I realized Dr. Ahmed is a very intelligent nephrologist, so he must have seen something in my life or in my career to ask me to do this. So here I am in the next 7 to 10 minutes talking to you all about how to be a successful nephrologist. Please bear with me as I share my slides. So in the next 7 to 10 minutes, I'll be discussing how to become a successful nephrologist. In the initial part, I discuss my early medical education, or for that matter, yours. You should always be careful as to why you choose nephrology. And the most important part is your nephrology training, which is the beginning of your career and is the foundation stone for your successful clinical life. And what are the components of your nephrology clinical career which will make you successful? And whatever you do, howsoever successful you are, please pay forward because it adds to your success. Now, in your early medical education, think very carefully as to why you want medicine. This profession should not happen accidentally, neither it should be an emotional choice. You should not be doing medicine because your parents wanted you to do it, or your father or mother was a physician. And if you have a choice, which most of us have, choose wisely the medical college you wish to train in. That medical college give you a complete 360-degree exposure, and it will help you decide choosing your sub-speciality. And during your medical training, initial medical training, get out of the training as much as you've given, because you all know how much hard work it is to be an intern or a junior residence. My early training was in JIPMER Pondicherry, where I did my MBBS. I did my MD Internal Medicine in All India Institute of Medical Sciences, New Delhi, the premier institution of our country. And my sub-speciality training was in Preston Medical College, Vellore. During my time, these 3 institutions were the top 3 medical colleges in our country. And I was really privileged to get trained in these institutions, not only learning medicine, but also rubbing shoulders with giants in the field. My mentors were all well known internationally, and they not only taught me nephrology, but they taught me many, many things which I wouldn't have learned anywhere outside. Then when you are actually deciding on your subspecialty, you have to know why nephrology. And you all should always choose this subspecialty because you want to be a part of it and you see yourself doing justice to it. Nephrology is a specialty closest to internal medicine. In India, we call it the queen and slave of all medical specialties. It's also, nephrology training includes fluid, electrolytes, acid base, the smartest part of medical knowledge. Nephrology is integrated with immunology, infectious disease, oncology, critical care, and most of physiology, pharmacology, pathology, and biochemistry. So it's an interesting and a very, very challenging specialty. There are difficult parts of the specialty. There are long, unpredictable hours, and there are many chronic patients with multiple comorbidities for whom whatever you do, they don't just seem to get better. The beginning of your career, clinical career, actually starts with your nephrology practice. Your clinical nephrology training is where you set your foundation stone for your clinical practice. Learn everything that you get the opportunity that provides to you during this 5 years of your fellowship. Your objective during this period is to grasp all aspects of the specialty. And you should also, amongst all these 5-6 subdivisions, decide your area of interest during this training period itself so that you can focus on that area a little more. And you should be very clear that this area is where you see yourself as an opinion leader in the future. As a successful nephrologist always has same role models. They are teachers, mentors who guide you throughout your career. These are people who have made a deep impact in your profession and your career. These are teachers you look upon when you have difficult decisions to make, either they are clinical, ethical, or moral. And for me, I was extremely privileged to have Professor J. Shim Shastri as my real role model, my professor in Christian Medical College, Vellore, who was a tiring figure in Indian nephrology. And then there was Professor Vidya Acharya, the first woman nephrologist in our country, who has been a pioneer in many, many ways. Never forget the people who have come before you and who have made nephrology as it is. Always remember that you are what you are because of them. The essentials of a successful nephrology practice is that you always keep your patient first. Your clinical practice will define you, and so maintain strong ethics and a rigid moral compass. Interact with your colleagues whenever you got an opportunity. You learn from them and the patient benefits. Interact with your cardiologist, your pulmonologist, with your gastroenterologist. Learn a lot of things, of nuances of medicine. Important to know how much money you make, what car you drive is not important in your success. But involve yourself in trials, collaborate, publish, teach whenever you can. Dr. Ahmed is a part of the International Society of Nephrology social media team, and he, like many of us, often use the social media to teach nephrology across the world. Do something beyond the ordinary. Keep abreast, learn new skills. In our time, there was no focus, no interventional nephrology. We are all learning it as a part of your career. This apparatus which you see is the microscope, which is in my office. This is something I think all of you as successful nephrologists do. Interpret your pathology slides. Go beyond the ordinary, take clinically complex cases, never hesitate to involve them. The first picture shows a lung transplant, a pediatric lung transplant on ECMO and on CRRT. These are difficult. You may be afraid, you may be anxious, you may be apprehensive, but never, never hesitate to take care of these patients. Many times in your career, you will be called upon to take care of celebrities. Never be worried about that. I had the privilege of taking care of this gentleman who was one of India's greatest film stars for about 9 to 10 years. I learned a lot from him. And always pay forward. I feel as a part of success in my life is the ability to take care of poor and vulnerable patients. I am privileged to be part of an NGO in Bangalore where we take care of type 1 diabetic children. And this, I think, is a measure of a success for all physicians, to be able to take care of people. Pay forward in many other things. Look and never neglect professional inequities. Help underserved, underprivileged colleagues, colleagues with professional constraints. And we are privileged, I am privileged to be the founding member of Women in Nephrology India, which has now got international recognition. Please understand your success multiplies if you are involved in others' success. Finally, don't get disheartened. There are many obstacles, many mistakes, many failures in this path. If Dr. Ahmed asks me to talk about my mistakes, I'm sure 10 minutes will not be enough. So please go through all difficulties, persevere, learn, study, sacrifice, and most of all, love nephrology. Thank you for your kind attention.